Imagine living in the medical capital of the world like New York City, but not having access to simple prenatal appointments because you can't afford copay. Isn't that crazy? My name is Vanessa Carrasco, and I'm the daughter of two OBGYNs who currently work in New York City. I've seen this luxury turn into a death sentence for a lot of women. And even though I might go to school in Connecticut, I believe that it's my duty to talk about my state and talk about policies that can be changed and revised within our society. To dismantle the systemic barriers in maternal health care, we must institutionalize and fully fund Public Policy Intro 472A to provide universal doula support to all women in New York City. So today I'll outline the crisis of maternal health inequities, the proven effectiveness of doulas, and what we can do to help make this change permanent. Systemic neglect and economic barriers are causing a completely preventable maternal mortality crisis in New York City. So according to the New York Health Foundation from 2020, Black women in New York City are 4 times as likely to die from childbirth-related causes than white women, reflecting a pattern of systemic medical neglect. As noted by Kalmus and Fennelly in 1990 in their study on NYC prenatal care, financial obstacles and motivational barriers like depression and high stress oftentimes prevent nearly half of low-income women from receiving the access that they need. So these aren't just statistics, these are everyday things. These are the mothers that my parents had to treat day in and day out that come into the hospital months late from their appointments because the system failed to reach them in time. Intro 472A provides a citywide doula initiative that bridges the gap between clinical medicine and community support for mothers. Scholarly research in the American Journal of Public Health demonstrates that doula-supported births lead to significantly higher breastfeeding rates and lower rates of low-term weight babies. Recent data from ResearchGate's study on NYC's By My Side program in 2023 confirms that participants, which are mostly Black and Hispanic, had significantly lower odds of preterm births, about 5.9% to 11.9%, as opposed to those without the doula initiative. While these numbers prove that the program just works, the solution is only effective if we put it into plan permanently. So we have to imagine a future where maternal health is determined by care, not by zip code or bank account. Picture in New York City where every mother and parent, regardless of her insurance status, has a trained advocate to navigate her through the birthing process, no matter how worried she is, reducing her stress and letting her voice her opinions during her birthing process. Without permanent funding for Intro 472A and state-level Medicaid reimbursement, we risk the program becoming another defunded pilot program, and that leaves thousands of vulnerable women back to square one, back in my city. So my mission is to expand the current law by securing long-term funding and universal borough right access. So in senior year of high school, I did petition to a lawmaker in the city council about funding for training for about 150 new community doula services for the state of New York, and passing law A5709 to mandate Medicaid reimbursement for these services by late 2026. So we've seen the systemic gaps, we've seen that doulas work, and we've seen what we can do to help change this. So we need to transition from these pilot programs to actual state-funded permanent programs for these women. My parents see the gaps every single day in the exam room today. Let's use our voices to close them forever. We can go on social media, we can talk to our lawmakers, or we can make a public policy like I did to talk about it, and no woman should have to give birth alone. Thank you very much.